Okay, so we're going to talk about cosmetic surgery tonight, but cosmetic surgery is just a branch of plastic surgery. So you've got reconstructive surgery and the cosmetic surgery. And under reconstructive surgery, you've got craniofacial surgery, and those predominantly are for little children who are born with funny shaped faces or eyes that are in the wrong place or funny shaped skulls. Nobody here tonight has that. It encompasses hand surgery with all the trauma and tendon injuries and arthritis. It encompasses breast reconstruction, cleft lips and palates. That's all reconstruction, things that have abnormal form and frequently abnormal function. Cosmetic surgery, what we're going to talk about, has a normal form. Well, it has a normal form, you just don't like it. It's too big and you want it smaller. It's too small and you want it bigger. It's wrinkled and you want it tight. That's what we're going to talk about. So when you talk about looking good, you got to know what your goal is. What's looking good mean? So these are the guys in Africa that look good. This is what they're trying to create in Africa that's a desirable feature. But in America, we're more looking for that. And guys, I'm glad you're here tonight, but there are not nearly as many slides with guys on them as there are gals, because there are a lot more gals that are interested in it than there are guys. So I'm pleased you're here. I'm proud of you. This is why I have a job, is because those beautiful women get older. Betty Davis, a classic beauty, doesn't stay that way. And that's how my kids get to go to college and things like that. So this is kind of one of our credos, is that we think we know what you want. You want to look good, you want to look normal. Anything other than that doesn't work. And you do that through safe procedures, honest appraisals, reliably and predictably good results, and something private, because you don't want the world to know. So one of the things we're talking about is wrinkles. How do you get wrinkles? Well, there are lots of ways you get wrinkles. One is a genetic disorder called progeria, and progeria is an autosomal recessive trait that makes 12-year-olds look like that. It's basically advanced arteriosclerosis. Nobody's got that here tonight. Another cause is, the chemical injury, smoking. And smoking makes you look older than you are. And it does that by decreasing the amount of oxygen you have in your blood. And it makes the small vessels clot and go away. So the end result is the tissues are getting less oxygen. They're starved. If they're starved, they age more quickly and you don't heal as well. Smoking's a bad thing. And I'm not talking about cancers. I'm talking about just your general health and how you age. And this is the mechanism that it does that. How about sun damage? We've all got sun damage. We all may not be smokers, but we've all got sun damage. Because we've all either done that or wanted to do that. And, sun comes in UVA and UVB and UVC. And we used to think for a long time that UVB was the only harmful ray. So we had UVB protection. But it turns out that UVA is just as harmful, but in 100 times bigger dose. Well, guess what? That's the same amount of increased UVA in natural sunlight as there is in UVB. So you need protection from both. That's how you could put sunscreen on and still get a tan. And that's how you can use sunscreen and still get the aging effects of the sun and some skin cancers. So whenever you buy sunscreen, look for UVA and B protection. And then natural aging. Aging is a process where there's less and less collagen in your skin. And that produces a thinning skin. It produces wrinkles, just like a piece of paper that's as thick as these cardboard folders, the fancy little Graper cosmetic surgery folders. If you fold those once or twice, it really doesn't get much of a crease in them. There's no wrinkle in it. If you take some of the thinner paper out inside and you crease that a couple times, there's a definite wrinkle there. You take some parchment paper and you fold it once and there's a crease. So it's thinner and thinner paper, creasing easier and easier. It's the same with your skin. Where you're young and you're 5 years old, you get thick, juicy skin that doesn't crease. But when you're 85 years old, that skin's gotten much thinner and it shows all those creases because it creases the same way every time. And that's why we get wrinkles. We get thinning of the hair, thinning of the skin, loss of elasticity. All of these things you can envision with that same 5-year-old. Thick skin, red because it's got so many capillaries. It's plump, full of water content, very stretchy. His grandmother, on the other hand, has thin skin because there's no collagen in it. It's gray because there are a lot less blood vessels in it, and it tears very easy. It has no elasticity left, and that's all because of the natural aging of the skin getting thinner with less collagen, less elastic fibers, and less blood vessels. And you can see it first in the 30s where you get the crow's feet they talk about, and you start to get these folds. These are nasolabial folds. And you get to 40s, you get the frown lines. In the 50s, you get the lines between the eyes. You start to get into hollowed out temples. You get the radial lip lines. In the 60s, it just keeps getting worse. So here's Brooke Shields where she started. And she probably could look like that right now if she hadn't been some of my colleagues in LA. And here's what she'd look like if she just kept going. And the important point to note here is you got to have good hairstylists, because it makes it all the difference in the world. So what do you do about all that? If you've got good genes, that's the best. So you look at your parents, and how did your parents do? Do they look good? If they do, do what they did. They don't look so good. What can you improve on? Were they smokers? Did they get in the sun a lot? Was their nutrition bad? What did they do that you can improve on? Certainly sunscreen is something that wasn't done much until the last 30 years maybe. So that's almost true for everybody. And then the skin stimulation, and Katrina talked about that for the skincare products. They use all of these things, but the big picture is you want to use a retinol or retin-A to stimulate the skin. You want to use the vitamin C and the alpha lipoic acid as antioxidants. You've all heard of the free radical scavengers that damage the DNA. If you have damaged DNA, the cells that the DNA are producing are damaged. So the vitamin C scavenges up those free radicals so they don't damage the DNA. It's great to put underneath your sunscreen. There's something that's not on here called polypeptides that instead of retin-A irritating the skin to make more collagen, it turns the key in that cell wall, and the cell just makes more collagen without having to be irritated with all the redness and flakiness that those of you who've used retin-A in the past, that's all gone. So we still use retin-A as to order the cells. It makes it look like fine furniture with like 10 layers of varnish instead of one. But the protein and the collagen in it is more the polypeptides we're using. The antioxidants is stopping the breakdown of collagen. So on one hand, you're building collagen. The other hand, you're stopping the breakdown. All ends up for more collagen and less wrinkles. And of course, a good sunscreen. I've got 5 wonderful estheticians, and I give them some direction about giving the best skincare that we can do and let them run with it. And they find products for me, and together as a group, we decide which ones we're going to use. We only use stuff that's going to work. That's the main thing. If we don't think we understand what you want, we're not going to do it. And if we do it, it's going to be safe and reliably and predictably better than it was, but it's not going to be perfect. I'd like it to be perfect. That's what we're aiming for, and it never ends up that way. You asked a question earlier, well, how do I know if I want to do that? Well, you got to have a real problem. You can't come in with a perfect nose and want to make it better. It's not reasonable. You got to be concerned about it. You could have a terrible nose and it doesn't bother you. You shouldn't have surgery. There's got to be a known surgical solution for it. If you come in with a problem, we go, wow, that's a problem, and you go, and I don't like it. But if we don't know how to fix it, if there's no way to do it or do it safely, you shouldn't do it. You got to be in good medical condition. You can't, be on dialysis and have high blood pressure and, have angina. You're not going to get surgery here. It's got to be predictable, safe results. It needs to be affordable. There are ways that you can get financing for it, and a lot of people do that, and that's okay. But believe it or not, complications do happen. They don't happen often, but they do happen. And if you're on the edge of being able to do this, and you really have no backup, and then you get a problem, then it's really a problem. So I would encourage people to get plenty of reserves, and you won't need them, but it's nice to have them. And of course, it has to be private. We're going to brag a little bit about ourselves. This, it's my practice. I'm a fellow of the American College of Surgeons, a member of the American Society of Plastic Surgeons, the Aesthetic Society of Plastic Surgeons, all of which means I went to 4 years of medical school and 7 years of residency and took all the right tests along the way, both oral and written tests, and passed them in plastic surgery. And you know, the medical world's a little strange these days, and not everybody wants to stay in the specialty they were actually trained in. And they think, oh, anybody can be a plastic surgeon. And so, you know, the gynecologists will be doing liposuction, or the ENT guys will be doing facelifts. Maybe they do a nice job, but you ought to know that they trained in ENT or gynecology. And so you can't just say, are you board certified? Because they could say, sure, I'm board certified, and they just don't tell you it's in dermatology or ENT or ophthalmology. So you should be able to feel comfortable asking, are you board certified in plastic surgery? And then go to our national website, the American Society of Plastic Surgeons, and look it up. I mean, I work really hard for all those credentials, so I'm delighted if you ask about them and prove them. The facilities are accredited by the American Association of Ambulatory Healthcare, so we got the same standards that the hospitals have for everything. We got all the emergency training, and this ACLS certified. We've never had a problem here, but we train every year on the defibrillators and all the drugs and all that stuff. But that's why we do medical clearance first, so we never have to use it. We really try to take care of people. We try to only do what we would actually do and think you're going to like. That's the way everybody ought to be treated everywhere. It's the golden rule, and it works.